because we've excluded a lot of kids from school and from sports because they came in contact with someone with COVID-19. By getting your children fully vaccinated, you can markedly limit that exposure.
FDA approved. The Food and Drug Administration is giving the green light for children 12 to 15 to get the Pfizer shot. Thank you for choosing us tonight at 6. I'm Brian McElhatton. Krista is on assignment. She'll be back at 11. If the CDC gives its approval now, younger Hoosiers would be able to get their shots as early as Thursday morning. Reporter Corinne Rose has more on what you need to know if you want your child to be vaccinated.
The science is clear. These vaccines are safe and effective.
Allen County's health commissioner says, as expected, the FDA approved the Pfizer coronavirus vaccine to be used in children 12 to 15 years old. A move, he says, can only help that age group, 17 million of them across the country. He says even though children's risk of hospitalization and death from COVID-19 is very low, it's not zero.
There are significant numbers of children and young adults who have long-term symptoms that can be disabling, that develop blood clots, that have other very serious or even deadly consequences of COVID-19 infection. So I would really urge everybody, regardless of age group, to get vaccinated.
The CDC is expected to issue its recommendation late Wednesday, and if it's favorable, Hoosiers 12 and older would be eligible to get the shots as early as 8 a.m. Thursday. Dr. Sutter says there are plenty of available appointments at the Memorial Coliseum's COVID clinic and that walk-ins are accepted too.
I think it's a good idea. I had the Pfizer and I think it's very effective, and I think it's been tested enough that it's safe for 12 and up.
I think it probably should be done. Health reasons, you know. These masks nobody likes anyway. Why not everybody and be done with it?
Dr. Sutter says an advantage to being fully vaccinated is that you don't need to quarantine if you've been exposed unless you develop symptoms, meaning it could be a game changer for kids.
That's huge because we've excluded a lot of kids from school and from sports because they came in contact with someone with COVID-19. By getting your children fully vaccinated, you can markedly limit that exposure.
To have your 12 to 15-year-olds vaccinated, you must go to the appointment with them to give consent and vouch for their identity. Moderna is already testing its vaccine on children 6 months to 12 years old right now, and Pfizer is testing its shots on kids 2 to 12. Corinne Rose, ABC 21.
And you can register your 12 to 15-year-old for a vaccine appointment by going to this website, ourshot.in.gov. You can also call 211. Many clinics are also allowing walk-in patients, but you may have to wait a little bit once you get there.